So I'll start again, and that is a good question. Okay, now the first thing to note is that no vaccine and very few medical interventions work 100% of the times. So you remember that when the question asked earlier about how effective is the vaccine, and one way to look at effectiveness is to look at how many people have severe illness. So the proportion of people, the risk of having severe illness after either the AstraZeneca or the Pfizer vaccine is cut by over 90%, but that still means that roughly 10% of people may experience severe illness even after having 2 doses. So again, it's about 2 things. One is we've achieved amazing success. We have 70% of adults in the UK having received both doses. That's one. They've received doses of vaccines that are very effective, so above 90% effective, but they're not 100% effective. So what we will find is that there will be some people in hospital, some people that have unfortunately died, and a small proportion of them would have been vaccinated. In fact, the most recent data I've seen suggests that of the people that have been hospitalized over the past 3 months or so with severe COVID, about 20 to 25% of them have been double vaccinated. So again, this is something that we will encounter just based on the fact that the vaccines are very effective, but they're not perfect. And that is, well, that's the point I wanted to make in response to that. And I'll pause there and see if Garrick wants to come in and add anything.
Thank you very much. I think that was a really good point. But let me bring some balance here, because I think largely from what I've seen in the public, there is some misunderstanding about what the vaccine is supposed to do. Can I just be very clear? The vaccine is not a cure for COVID-19. What the vaccine is meant to do is to, 1, reduce hospitalization, 2, reduce illness that may be caused by coronavirus infection, and 3, to reduce transmission from person to person. That's really what it is. And if we can achieve all those things and the virus is limited or restricted from spreading in the population, then eventually that may die out. And then we get to some state of being able to live normal lives, whatever that may look like now. So let's just make that very clear. And I think a lot of people are under the understanding that what this should have done is cure the disease and everything is over and done with. That was never the intention for the vaccine. And also, although it's been explained very well already, we do expect to see person-to-person variation after taking the vaccine. There are many factors that could contribute to this. There could be age, for example. We know that immunity diminishes the older you get, for example. There could be underlying clinical conditions which varies from person to person, and so you would expect variation in the population as people get the vaccine. But with that said, the data is very strong that the majority of those taking the vaccine are protected, have strong immunity, hospitalization has been reduced, death rates have been reduced, and disease or the symptoms from COVID, corona infection has also been reduced. So those are strong things to go on to say that the benefits outweigh the risk. And I think that's one way we should look at it.